Hi, I'm Dr. Kenneth Fink. I'm a medical oncologist at Zimmer Cancer Center at New Hanover Regional Medical Center in Wilmington, North Carolina. Detection of cancer is the most important aspect of cancer in terms of finding it early. The earlier we tend to find it, the better we think your chances are of getting the good treatment. Detecting it is very difficult, however, and it's difficult for patients and it's difficult for doctors to detect cancer. Cancer can come from many different parts of the body, and it can cause symptoms that may mimic things that may seem rather everyday. For example, low back pain or something along those lines. But in general, patients are encouraged to do exams on themselves. Women do breast exams, do self-breast exams every month during their menstrual period, for example, or if they're not having periods, just try to pick a day of the month where they should examine their breast. Usually done in the shower. They'll feel the breast in all around and make sure that they don't detect any lumps or bumps. If they do, they need to get to their doctor right away, and special tests can be done. For men, there really aren't too many. For young men, for example, testicular cancer can be a problem, and men should do self-exam of their testicles, and they can, again, just feel them perhaps one day of the month if they're thinking about it and be sure they don't feel any lumps or bumps there. And if they do, they should go see their doctor. As far as doctors are concerned, when we see people who are well, but we want to do some checks because they may have a risk for cancer, let's say a family history of it, we'll do some extra tests. Certainly women, as they get into their 40s and 50s, will have mammograms, and we'll try to detect breast cancer in them. For people over 50, we certainly want to also look for colon cancer, and the doctors will often advise a patient to have a colonoscopy after the age of 50. Once you've had a normal colonoscopy, you're good for 10 years. You really don't need another one for 10 years. The risk of actually finding a cancer on any of these screening tests is actually quite low. So for the most part, patients can feel pretty reassured that they're going to have normal tests. But it's best to have this checked, and if done on a regular basis, your chance of finding the cancer earlier and therefore having a better treatment for your cancer will be superior.